This is Crystal Phend with MedPage Today, here in Chicago at the American Society of Clinical Oncology meeting, where researchers have reported results from the MAP3 study showing that the aromatase inhibitor Exemestane protects at-risk women from developing breast cancer. I spoke with leading breast cancer specialists about what these results might mean for clinical practice. Dr. Jennifer Litton of the MD Anderson Cancer Center explained why another chemopreventive option would be valuable.
Well, right now the only drugs that we have for prevention of people who are at high risk of developing breast cancer is tamoxifen for premenopausal and postmenopausal and raloxifene for postmenopausal women. However, a lot of women choose not to take these drugs because of concerns of the very rare but serious side effects of uterine cancer and blood clots. I think this could potentially be practice changing, especially if women want to try something but they're weary of taking tamoxifen in particular. It could be another option for chemoprevention.
The relative 65% reduction in invasive breast cancers with the aromatase inhibitor compared with placebo didn't come as a surprise to Dr. Laura Esserman of the University of California, San Francisco.
We expected this. We know that the contralateral risk reduction for women taking aromatase inhibitors, again, is slightly higher than it was for tamoxifen. These are the things that drove the prevention trials in the first place. And it will be practice changing for us. We have a huge prevention effort through the Athena Breast Health Network where we are going to be doing risk assessment and looking for people at highest risk to develop breast cancer and be looking to offer them options. This will be one of the options that that needs to be on the table.
The safety profile of Exemestane may actually make the drug a preferred option, according to Dr. Edith Perez of the Mayo Clinic in Jacksonville, Florida.
It is clear that Exemestane has a lower toxicity profile compared to tamoxifen. So that's going to provide people with a lot of reassurance associated with the use of a medicine to decrease the risk of breast cancer. So for postmenopausal women, I am convinced that Exemestane would take over the use of tamoxifen for that subgroup of women. However, it's also important to realize that Exemestane is not an agent to be recommended for patients who are premenopausal. It's only for postmenopausal women.
But Exemestane isn't totally risk-free, as Litton noted.
It does have a set of side effects of its own, which is joint pain and stiffness, some menopausal symptoms such as hot flashes, and bone loss.
Exemestane is not yet approved for primary prevention use in women at elevated risk of breast cancer, but this use could play an important role in the fight against breast cancer, according to Esserman.
There's only so much more we're going to get out, so much we can get out of screening. Screening is not prevention. The whole point is that we now need to be integrating risk assessment into the point of care. And when we identify people who have threefold increase in risk or have a 35–40% lifetime risk or 30% lifetime risk, especially young women with atypia, these are the women whose risk we can reduce. And tamoxifen for premenopausal women has almost no side effects. It's got a bad rap and people don't think about it, but if your risk is very high, and you have something to gain from it, it's great. And there's actually recent data that Jack Cusick just published from the IBIS trial saying that if your breast density changes by about 10% in the first year, that's where all the benefit is. So you've got indicators that specifically identify people at particular risk, drugs that work, and short-term outcome markers that tell you whether the drug is working for you. These are the kinds of things we have to package together and get to women. If we really want to make a dent in breast cancer and reduce the chance that they're going to have to go through difficult therapies or die from the disease, we have to get serious about it. This is great data, and I don't think it's going to take very long to get an approval indication on the basis of this, and I hope to see this in clinical practice within a year.
The other aromatase inhibitors could find a similar role.
Other aromatase inhibitors, and there are two others in clinical use, anastrozole and letrozole, appear to be similar to Exemestane in the advanced or metastatic breast cancer setting. So I actually feel that the data from Exemestane could also apply to the other aromatase inhibitors. So this is actually good news for patients. It's good news for the field, certainly, demonstrating that now we have an agent that can decrease the risk of breast cancer events with very low toxicity. This is good news.
So Exemestane and potentially other aromatase inhibitors could expand primary prevention to more at-risk women. Here in Chicago at ASCO, I'm Crystal Phend, MedPage Today.